Hepatitis is an inflammation of the liver that can cause a range of other health problems, and sometimes it could be fatal. There are 5 main strains of hepatitis virus referred to as types A, B, C, D, and E. These all differ in important ways, including the modes of transmission, severity, and prevention methods. Just to mention, types B and C lead to chronic disease in hundreds of millions of people, and they are the most common cause of liver cirrhosis, liver cancer, and viral hepatitis-related deaths. Some types could be preventable through vaccination. Before I delve into the causes of hepatitis, symptoms, and prevention, please click on the button and like this video. Also share with friends who could also benefit from the information. Thank you and keep watching. Hepatitis is often caused by virus. Heavy alcohol use, toxins ingested into the body, some medications, and certain medical conditions can also cause hepatitis. There is also an autoimmune hepatitis which occurs when your body makes antibodies against your liver tissue. Hepatitis A is caused by exposure to hepatitis A virus from infected food and water. It's usually acute and short-term. Hepatitis B is caused by exposure to hepatitis V virus in various body fluids such as the blood, vaginal secretions, or semen. It is an ongoing chronic condition, and it is estimated that around 250 million people worldwide are living with chronic hepatitis B disease. Hepatitis C is also caused by exposure to hepatitis C virus in body fluids, while hepatitis D and E are caused by exposure to blood containing hepatitis D virus and exposure to food or water containing hepatitis E virus, respectively. The other types of hepatitis, the non-infectious hepatitis, are caused by excess alcohol consumption, which damages the liver and causes inflammation, as in alcoholic hepatitis. Also, hepatitis can also result from misuse of medications and exposure to toxins. For autoimmune hepatitis, the immune system mistakes the liver as harmful and attacks it. Autoimmune hepatitis is 3 times more common in women than in men. What are the symptoms of hepatitis? For chronic forms of hepatitis like B and C, symptoms don't show up until the damage affects liver function. However, acute hepatitis presents with symptoms shortly after contracting the virus. Common symptoms of infectious hepatitis include fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, loss of appetite, unexplained weight loss, jaundice. If you notice any of these symptoms, reach out to your doctor to assess you appropriately and recommend a treatment plan. Tips to prevent hepatitis. Number 1 is vaccines. There are vaccines that can help to protect against hepatitis virus. The Center of Disease Control and Prevention recommends hepatitis B vaccinations for all newborns, administered in the series of 3 vaccines over the first 6 months of childhood. Vaccinations against hepatitis B can also protect or prevent against hepatitis D virus. There are currently no vaccines for hepatitis C or E. Number 2, reduce exposure. Since hepatitis virus can transmit from person to person through contact with body fluids, water, and contaminated foods and fruits, the infectious agents, or rather containing the infectious agents, minimize the risk of exposure to these substances. Practicing effective hygiene is one way to avoid contracting hepatitis A and E. The viruses are present in water, so if you are traveling to a country with high prevalence of hepatitis, you should avoid local water, raw or uncooked shellfish and some seafoods, raw fruits and vegetables. To reduce the risk of hepatitis B, C, and D, avoid coming in contact with fluids containing these viruses by not sharing needles, not sharing syringes or razors, not using someone else's toothbrush, not touching spilled blood. Using barrier methods during sexual intercourse can help decrease the risk of hepatitis B and C. Get in touch with your healthcare provider to review your risk of contracting hepatitis and follow through all recommendations for prevention. Thank you for watching till the end.